Well, hello everyone, and welcome to the online conference for 2026. My name is Lisa Palladino Kim. I am a lecturer with the School of Health Professions. I am in the Department of Health Informatics, which has a master's in clinical research management. Today, what I would like to share with you is about the AI-powered simulations to enhance clinical research skills. We're going to talk about a virtual healthcare simulator and how it was expanded and the examples that I used during my course. Let me give you a little background about our program. So we are the clinical research management. It is a master's program. It's about 36 credits. Majority of the program is online. We do have 3 tracks. So my particular track is more of the online track. And in addition to that, we try to make sure that we are building broad and well-rounded foundational material for a clinical research professional. Now, sometimes our classes are synchronous, but majority of them are asynchronous. So engagement is a huge issue, as well as making sure that these students are learning. What we try to do is map our program to clinical research competencies. So out there were core competencies in a framework that was approved, published, and is now used globally. It has 8 domains, as you can see, and each domain covers different areas. So scientific concepts or clinical study operations or leadership and professionalism, communication and teamwork. We mapped it to our individual program. So as I mentioned, we have 3 tracks. One of the 3 tracks covers all of this information. So we talk about theory of research, regulatory and legal frameworks, disease process, multiple applications, and so on. But the biggest one we get to is the clinical research operations courses, and that is mine. So what I wanted to do is take this information that they're learning every day, but make it a little bit more interactive and fun, and apply the concept that we put together at Rutgers. So you may have heard of Rebecca Brody. She has put together the Rutgers Virtual Healthcare Simulator. And a lot of our faculty members are doing different projects off of her initial idea. She created the virtual hospital. And then what I did is I took that idea and I expanded it to include the clinical research ecosystem that is going on. So from there, I created a clinical research site. Similar to, you may have heard at Rutgers, we have CINJ and they do oncology research. Here it is dealing with a bunch of different types of research. We tried to keep it a little bit on the broad side, but we did create a title, a name for our organization. We also came up with a logo and a mission that we wanted to follow. In addition to that, we created individuals. So we have a primary investigator, a clinical research coordinator, as well as this brand new coordinator coming in that's kind of nervous. So we have different personalities for each of our characters. So when the students are interacting with them, it'll be a little bit different of how they'll get responses. In addition to that, we definitely made sure we had their role, but we also wanted to give them a little bit more background. What's the years in the role? What was their education? Maybe a little bit more about their personality. And then I mentioned some of the strong notes. So when the students are interacting with them, when they deal with Billy, he's going to come across that he has a strong rapport with the trial participants. He often mentors the junior folks, and he's really humorous and extremely thoughtful as he goes on. For the location that we created, we tried to pull in some community demographics and research profile that fit the New Jersey area. So even though our program is online, we were still trying to keep true to Rutgers and the area that Rutgers is in the New Jersey. So as I mentioned, we focus on at first the academic clinical research site. So the site's dealing with the primary investigator, and from there they have support with the clinical research coordinators, the study nurses, the regulatory coordinators, as well as patient engagement specialists. And that's not all, but that was just some of the job roles that we teach within our course. But our program also covers other organizations. One is dealing with a sponsor. So you may know of different sponsors that are out there. The ones that really come to mind are like your Mercks, your Pfizers, your BMSs that are out there. By NIH, you may have also heard of NIH being in the academic field, is also a huge sponsor of clinical research trials. There's also academic institutions. Rutgers has that CINJ where they do investigator initiated trials, as well as even private foundations. So Michael J. Fox does research. So what we wanted to do is make sure that our students has a sponsor that they are looking at. What we did is we did define one sponsor to start off with, and we try to keep it more like a pharmaceutical sponsor at that level. But sometimes sponsors outsource their work. And when they outsource the work, it goes to that clinical research organization. And they do some of the job roles that your sponsor does. So here's just a list of a few. So a project manager, research associate, regulatory specialist, supply specialist, finance specialist. So what my clinical operations courses does is it takes all of these different job roles and it teaches the students throughout the course that this is the process we go through for running a phase 1 to a phase 2, phase 3 trial before FDA approves the drug. And these are all the different departments as well as the different job roles that handle all that information. So we teach them about the sponsors, the CROs, the academic sites, and the regulatory bodies. So I showed you the one that we made for the sponsor. Well, we also made one for the, I showed you one for the site, but we also made one for the sponsor, as well as making one for the CRO. So this just gives you a little bit more insight into what it looks like. So again, I created names, I created color organization and branding to make sure that throughout the program, they will see the same branding. I try to make sure that the names really fit. So, Lunaris is guided by the precision of renewal. Solatera is dedicated to advancing health and sciences and healing. So it kind of fit that that would be your name. And then because the CRO is bridging the sponsor to the clinical research site, because they're an outsourced organization, I thought Trial Bridge fit very well. And we put them out in San Francisco. So they have a little different feel than this was trying to give you more of a local or more down south, kind of an Italian feel in a way. So from there, after I created the locations, we then had to start working on the assignments. So within this particular class, the clinical operations and management, I had 7 students to try and pilot this with. I had 2 assignments that I incorporated. One was the metacognitive practice for professional communication, and the second was the corrective and preventative action analysis. So let's get a little bit more into detail with those. So the first activity, that metacognitive practice for professional communication, I really would like to do in my classes is have it feel like a safe place. Students need to feel that they can go out and practice, make mistakes, understand that it's okay. How do I improve it and change it? And we do. We have some individuals that come into our programs that are seasoned professionals, but we also have a lot of folks that are brand new, never worked in a corporate environment before. So they may need to practice that. So what we wanted to do was create a scenario then that the students were acting as a coordinator at a clinical research site. And then we had a PI, primary investigator, and they were having a simulation conversation. So what we wanted the student to do was explore a certain protocol that was written that the site would follow to do a clinical research trial. See if they found anything that was really unclear or maybe needed some further explanation. I wanted them to then write 4 questions without AI assistance, see how they would write it, what they would put together, what was their clarifying questions. And then I kind of give them an example. Protocol allows for dosing modification if the participant is a perceived excessive weight loss. Could you clarify what's the operational criteria to define as excessive? And is it based on their body weight, their BMI, or a clinical judgment? So this is a question that the students might have when they're reading that protocol. That then they will go into ChatGPT, copy a prompt that I created, insert that prompt, and then have a conversation with the primary investigator. So their goal is then to pretend that they're having a dialogue, ask your questions, clarify how they are, see if there is any action that they might have to do now after the investigator talks to them. And then at the very end, they're going to ask for some feedback from AI about how did they do? What was their tone? What was their clarity? Were they professional in the word choices that they used? and AI would give them an idea. So here's an example of that dialogue I was talking about. And we're just going to pretend I'm the CRA student. So I might come in and I might go, we have these guidelines that are out there. And per our protocol that we were looking at, there's section 5.1.1, and the protocol says this. And I might list out what the protocol says. And then I might list out what my question was. And this is where I'm, curious. So then after I type that in or I verbally say that into ChatGPT, my primary investigator will then answer. So they first started off as excellent question. Yep, I can see that. They're going to say that the sponsor clarified that this criteria would be this. So to operationalize it, what we need to do is XYZ. So you can see at screening, they need to document the comorbidity. The cardiovascular condition is weight related. So then, are you correct to catch all these nuances? And then what they would recommend that the student should do. I maybe would escalate this to the sponsor through the CRO that we have, so that trial bridge solutions, to confirm that this is correct, and that maybe we have to put a file in our regulatory binder. So that way, if we had another study coordinator comes on, they also have this clarifying note. Then in addition, ChatGPT on its own prompted before we moved on, how would you word this in your note to file when you ask the sponsor for clarification? So ChatGPT actually took the conversation further than I was planning to, and even asked them if they wanted to practice putting that note together. So I thought that was a great way to expand the students' knowledge. We got a lot of feedback regarding this. Some of the feedback listed with the learning and the clarity. They were saying that they really saw the importance of it. They now understood that when they read the protocol, maybe they didn't understand everything, and this helped them realize it. They also felt communication and personal growth was very important. So their interaction with Dr. Patel felt more live, like they were talking to an individual. They also felt that they could make mistakes and then make some changes of how they approached her. In addition to that, some of them never had experience with ChatGPT and or some other large language models. So this was great to have that experience to see, and it wasn't as scary as they thought. So they really did enjoy the role playing that they went through. So then we also had a second activity that was a little bit more complex. And what this activity really focused on was doing a corrective and prevention action plan. So it's really, the best way to put it would be root analysis. They were trying to find out what was some causes. So I created all of these documents, put them together, had them go through this exercise in a scenario, and then they would have to produce some output after they talked to ChatGPT. So my goal was to enable the students to investigate that root cause. They are using regulatory non-compliance documentation, so it seems there's guidelines we have to follow, and this particular site was not following them. So maybe an example would be they didn't get an informed consent signed when they had the patient come into the clinic. Or maybe because this was a BMI study we talked about earlier, maybe the BMI wasn't in the range that the study requested. So that person should not have been enrolled in the study. Things like that, that the study or the personnel was doing things that maybe wasn't compliant with the protocol and or just how we should handle good clinical practices. And then what they had to do is then communicate with the staff to come up with a corrective action plan. And they needed to understand how the staff worked. What was some of the reasons that might be giving them the cause to make these mistakes? Is it just a one-off or is it a trend? And then if it is a trend, where could they fix it? Whether it was education or training material, was it the way they're going through their process, maybe they're not giving enough time to have with the patients. So there's all these other areas they could come up with as a correction. So the scenario was that during that inspection, they got a form, FDA 483 observation. So it's this big sheet that tells you what's all wrong and which guidelines it goes to. They have to follow the inspection. So the student has to review the findings. They role play that investigation and they come up with a root cause. Now, I did base all of this as if there was a live, real investigation that went on. I did tailor it to the site that I created, so VTAR, and I wanted to make sure that it was using accurate information. So I designed issues for first up. You failed to ensure that the investigator was conducted according to the investigational plan. And then here's some issues that I found, and here's 3 patients. So I actually had to come up with like patient numbers because you can't use real names in clinical trials. So I had to come up with then, okay, you enrolled and randomized despite documentation of a history of hypertension requiring medication. So this was something that should be excluded. And this violated in the protocol section 5.2. So we now know it's a violation. They shouldn't have done that. And then there's another one, recognizing the date, they were randomized because of this, or someone else gave them administered drug before they were eligible to even have the drug. So these are 3 different violations that occurred. They're different, but they would have to have that conversation to find out what to do. I gave them an Excel spreadsheet with these findings. And then I also gave them a template that they would have to fill out as they went through this process. I asked ChatGPT to stay in character. I provided all the background information that ChatGPT needed. So it was educated, it was realistic, it was very content related. I wanted to make sure that the issues were being revealed, that it wasn't that the site coordinator was giving them an answer or the PI was directly giving them an answer. Oh, well, this is why, so this is your corrective action. I want it to be where they were giving a story and situation, so the student had to figure out what the root cause was. They were not allowed to provide solutions or recommendations. That was huge. So I had to make sure that was in my instructions to ChatGPT. And they had to let the student analyze and determine that action. When it was all done, I did say, when you hear, or it was typed in, I am ready for the summary, then those key points and problems would be listed out, and the reflection of the assignment would have been done from ChatGPT. So the students would have some sort of composite at the end. Now, I also gave student instructions. So they had to begin by saying, to start this off after they got ChatGPT set up with my prompts, I'm investigating the FDA, observation. They had a request to speak to different characters. So instead of having them only talk to one character, they had to talk to 3 people at a site and one that was the CRO, the CRA, the liaison person between the sponsor and the site. So they had to say who they wanted to talk to at that time, or if they wanted to talk to all 3 at the same time. They had to introduce the situation. They had to have open-ended questions to make sure that they were getting a broad in look. And then there was a dilemma that we have because our students don't have access or the pro account at this time. So we did have a limit of 20 questions, or they could copy it all again and input it again, and then ask another 20 questions. Sometimes there was a time limit, sometimes there wasn't. It depended on their system of the day. And then again, at the end, they would ask for that summary. So what came out of this? So I noticed, and I think we've all heard in the past, that ChatGPT does do hallucinations. I don't know if you've experienced it, but if you ask it to give you a publication, sometimes it makes its own publication that never existed just to prove your point that you're trying to prove. So we had to make sure that we try to mitigate them. And that's why I fed ChatGPT my scenario and a lot of details to try to make sure that it would give accurate responses that would be in a clinical research setting. I made sure I tailored all the templates. So then that way it again fit with my site and the site title, the name, the border, the color scheme, even the font type. So then that way it felt like they were at the site having these conversations. I definitely wanted to verify the ChatGPT outputs. So I did ask the students to give me copies of their scripts as well as the different output of that. This way I can go back now and kind of do like a check to make sure that it's working accurately and if there's any modifications I need to do in the future. And then guided simulation partner, it's not a sole resource. So we did want to make sure we emphasize that this is a resource you could use to practice this, but it's not the end all be all. And you still might need to investigate some of the situations. So with that, I want to say thank you very much. I would definitely want to say thank you to Becky Brody, Jason Stevens for starting this, and then also the SHP SODL team. They were very supportive. And if you need to contact me, again, I am Lisa Palladino Kim at Palladil or at PALLADLM at shp.rutgers.edu, or you can even go out to the website and you can find more about the Rutgers VHS. And then in there, you'll also see my profile. So thanks very much and have a great day.